guys, welcome back to my channel. It's your girl Benedicta again. Thank you for 65 subscribers. I really appreciate. Just started this YouTube and now I have 65 subscribers. I just started this YouTube just because of something that was bothering me about African women, how I'm not seeing them at the place of work. But I'm so grateful that so many people got interested in my video and they start asking me about Ausbildung, how to start, and I've really explained a lot about Ausbildung, and I've gotten so much comments, so much questions. That means people are listening to me. That means people are taking advantage of the information I'm trying to bring out, because information is very powerful. Without information, people cannot do anything. People don't know there are so many things out there you could do, but only when we have the knowledge of it that we know, okay, yeah, there is something like this. Okay, let me give it a try. So I want to say thank you first to my subscribers, and please share my videos so others can benefit from you just the way you too have benefited from my video. So today I have some questions that some people asked me about the Ausbildung, which I want to answer. I don't want to make this video so long, so I will just go ahead and answer some of the question. So my first question was, what is the exam during the Ausbildung is like? So I will first of all talk about the first year, because the person have not started Ausbildung said she's about to start. So I will start with the first year. The first year, you will first of all be doing tests, which they call Klausur. You will do it, and is always 3 parts, the same like the exam. The Klausur is still exam, but first of all you first do it as test after I think 3 months, and then you do it in 6 months, which will do your probate site. If you don't pass it, they will drop you. Yes, if you don't pass your probate site, they will drop you. If you are doing the 1 year Ausbildung, after 3 months you are going to do probate Prüfung, but so many people used to pass it. So is 3 parts. The first part is normal exam, which is schreiben, to write, everything they've taught you, maybe anatomy and urine, everything that you've learned during this 1 to 6 months or 1 to 3 months before the Klausur. That is what they are going to ask you during the exam. They just ask you few questions, like you should mention parts of the body and all that. So normal anatomy questions and all the things that you've learned basically as normal exam that we used to do. But the good thing about in Germany is that they cannot ask you question of what they've not taught you. Not like in Africa, that in the university you just send you a textbook to read, and before you know they ask you questions that you don't even expect. No, this one is everything that you've learned. It's just that because of the language making it to be difficult for us, when we translate this thing, they always look easy, but because of the language, like it's tough. But normally it's not too hard. Then the first part is writing, as I said. Then the second part is from our own that we did. The second part was practice in the hospital. So they will send somebody from the school. Everybody have how would I call it? Everybody have somebody that will be coming to check how you are working, how you are doing. They still ask the pflegeassistent there about this Schulering. How is the person doing? How they will get information from you. They will still give you a paper which will be given to your pflegeassistent. That pflegeassistent is like somebody that is supervisor in that station, that you will be marking whatever you've learned. Sometimes you people will sit together, maybe once in a month or once in 2 months. People will sit together. She'll ask you, okay, ambulante pflege, infusion, documentation, this. They will mark the paper, then you give the paper back to your school. But you still have another person in your school that they will send, that will be supervising you too. Will be coming to the hospital and check how you are working. Will tell you to come, that you have a Gespräch. Both of you will sit down, will ask you 1 or 2 things. How is the work? How is the people? This and this. What have you learned? Then you start to talk. So in the practice, that one will be coming. That one is not among the exam, but during the exam it will come. But the person will be coming to check you at time to time. They will let you know you have the so this so person is going to come. So, but in the exam or in the class one aspect, in the practice, they will take you to a room, maybe a room where your patient is, because like when you are doing Ausbildung, you have a patient, maybe a person that you can do copper pflege, that's early morning cleaning, changing of diapers, cleaning person. So they want to see how you are doing it, whether you know how to do it correctly, which the correct way is. If you want to do pflege in bed, you have to have all your equipment ready, the room temperature, you have to know everything. You have to know, like you have to know you have two they call it this small towel to clean the face, and towel. Then you still have normal length and towel, the long one, which you will use to clean the body too. From that too, it is very important for you to always know that it is two. Even when you are working, it must be two from each. Then the soap, everything, you have to make it ready. Then you have to ask the person that you want to clean, the person that, if this person is not too sick that you can ask, you have to ask the person, how does the person like the water, whether warm or lukewarm, anything. You have to talk to the person. You have to communicate with the person, not that you just go and carry water and start cleaning, pouring somebody. You have to ask all this. They want to hear it during the exam. They want to hear you say it, that you have to ask the person whether the person wants with soap, whether the person like the temperature to be like this. Then once you enter the room, before you even start all this, you have to turn on the heater to certain level so the room can be getting warm before you start preparing your things. It is very important during your exam, during your test, even when your supervisor come and want to see how you are working. Some days your supervisor can just come. You would think maybe you just want to come and ask a question. You can say, okay, today, Benedicta, I want to follow you to your room and see how you take care of the patient. So don't forget to do all these things, to make sure you have all your things very well. Maybe when you enter together, you just go straight to the heater, you turn on the heater, then you go to the person and greet, good morning, wie geht's Ihnen? Then you start asking, how do you want today? You are to clean you. How do you want your water? Do you like it hot or lukewarm? Or this will tell you not too hot. Or many of them, they don't like hot water, they like lukewarm. All these old people. Not that it's only old people you have to do, but most of the people they take you to do. There are all these maybe sick people, old people that are in the hospital. So you ask all these questions, then they will tell you what they want. Then you bring everything, you put it on the table, and when you the bed guitar, this bed guitar in English, I don't know what they call it in English, this one that used to stay like this on the bed, when you put it down, when you want to clean, don't ever forget to raise it up. That carries a lot of points, because the person can roll and fall down and the person will die and you'll be in trouble. So everything that you do, put it on your head. When you enter the room, how you saw the bed, make sure you do it that way. Not that you go, the bed was up, you cleaning the person, you just pack your things and you go and the bed is down, the person roll boa on the floor. So always be careful, always watch. Everybody make a lot of mistakes, but learn from your mistake and ask questions. Always watch when you follow another person to the room. Everything the person is doing, my dear, open your eyes and look. The one you don't understand, ask, why did you put this thing down? He will tell you. Why did you take it up after? You will ask. Many of them don't even like you to be asking them questions. Many of the people that are working there that you are following to learn, ask so that you have idea. So that is the practice part. Then come to oral part. So the oral part, most of it is in the school. So they will ask you, they will list some kind of thing, maybe copper pflege in bed or in batesima or prothesia, these plastic teeth, artificial teeth they put in their mouth. So they will list many of them. They will tell you to pick anyone. Maybe for instance, you pick copper pflege in batesima. That means to clean the person's body in the toilet, in the bathroom. That is what you pick. So you have to talk about it. The same thing, You take your towel, your hand towel, you want to wash the body, you take your two towel to dry the body. You ask the person how the person wants the water to first, where are you starting from? All these things you have to talk. When you finish bringing the whole thing, you start from the face to the shoulder to the armpit, and you are not going to use the same towel that you use for the body to clean the intim, which is the private part. Know that. So that is the exam. So I think I have answered some of your question, which is all. If I want to talk about it, to narrate how the exam is, I think the video will be very, 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 very long, because you should understand how exam is. So, but I will tell you, the more you go to school and learn, the more you understand this thing. It's not something somebody can just tell you, oh, but it's just tip I have to give you. At least one or two things I've said, if you say it at school, they will know that, you know what you are doing, because at least you have idea. So many people don't have this idea. So many people have never been in the flager. They don't even know what to do. But if you mention, maybe they ask you, now, at least since you've watched the video, you can say, okay, you have to take two client handsoap, two grocer handsoap, then ask the person the room temperature. You have to put it in warm. You have to start from the face, and the towel that you use to wash the body, that's not what you use, and that towel to wash the intim part. When you start saying all these things, that intim parts meet private part, so they will know that you know what to do. My God, this video is now long, so I think I'll just answer only this question, and I'll make another video to answer another question, because I don't like my video to be too long. So I'm always feeling so happy and interested, because my job, this Ausbildung, I never knew it's something I would like that. That's this nursing job. I never knew something I would like that. But I find myself, when I'm talking about it, I feel so excited. I want to talk and talk and talk and talk and talk. Please don't blame me. It's just part of me now. So when I'm talking, I have a lot to say, because I've gotten experience. I've suffered in this flager. It's not that I just got it like that. No, I was humiliated, I was bullied, everything, because of the language. Sometimes documentation, I cannot write very well. I don't know the words. So be prepared for all this, and don't take it too personal. Yeah, sometimes you go to the bathroom and cry yourself out, but remember what you are trying to achieve. Just remember what you are trying to achieve. People will bully you. People who don't want to work with you, they will say, because you don't know how to speak. But later, show them what you got. That this thing, I know, language is hard, because you can be working with somebody, some of the nurse, they can just tell you, go and bring so thing. You have not heard this thing before in your life. You don't even know how this thing look like, and telling you to go and bring it. And maybe she was there busy, maybe cleaning wound, and just tell you, you start running, you run to the lager where they put all those things. You don't even know what that thing is. You start looking, my God, it's happened. You come back and they look at you like you are one stupid person. Then you start saying, I didn't know what this thing. That's why I advise people, do practical first before you start Ausbildung. Do practical. In fact, if you finish your practical, maybe you finish your practical January and your Ausbildung is September, please go and work in Eternheim or anywhere, because it will help you a lot. My own, I'm a living witness, because I suffered. I didn't have idea. I did practical, but I didn't do my Ausbildung immediately. The practical, I stayed at home almost 2 years more before because I did my practical when I finished B1, and I was trying to get B2, So, but no, I didn't. They would just tell me something like this. That's how our job is. What are you talking about? I don't know this thing. I don't have idea of this thing. I will start running. If you see the way I run up and down there, the only thing I know I gained there was I reduced weight, because I've been trying to lose weight since, and I couldn't. But that thing helped me to lose weight. I was just running up and down. Go and bring this, and we'll get there. Sometimes on the way I forget. That's why I used to have paper in my pocket. See that one? Nursing shirt that have 2 pockets here. Make use of those pockets of paper. Always have paper. Even if you don't spell it well, at least spell it the way you understand. If they say go and bring so thing, you write the thing, so that, because our children disturb us at home, we are running again to work. They tell you this, they tell you that, they tell you, bring this, go there, take one of this, take one of this, take one of this. They are just telling you in the mouth. Please write it, so that when you get there, at least you can see, or you can see somebody and say, you are looking for this thing and this thing, they will tell you, so you don't look stupid. that was the idea I started doing. I started, once I get in the morning, I fold my paper, I put in my pocket, put my pen, and I'm ready to follow them up and down. Because we that are doing Ausbildung, then they are the one that they use. Yeah, you are the one that they are going to be using up and down. All the messages, you. Whether you are older than them, some of them, they are 17 years, 18 years, 20 years, and you are 30, 35. They send you up and down, and you have to do it because they are watching you. They are watching you. That's all the things they put in your record, that, yeah, you are flexible, you are good, you do your work, you do this, you do that, you don't complain. They are watching you, and since you are doing your hospital, please, they sacrifice it. Don't say, I'm tired. Do it. Run. In fact, sometimes when they even say, I need something, agree that let me go and get it. Go for, even if they didn't ask you, just say when they are doing something, this person, who go downstairs and pick so patient, our new patient, let me go. Just rush and go and do it. All those things, they are seeing you and they are watching you. If you even finish, if they want to employ you there to work, it will be better because they know you, that you are somebody that is really ready to work. So I've answered your question, and I've talked even what you didn't ask me. So please, if you have more questions again, ask me. I will let you know. Thank you for watching my video. Have a nice day. Bye.